Hey guys, in this video I will explain you briefly what is the difference between PLAB and MRCP. If you want to practice in the UK, then you must be registered with the General Medical Council there, which is possible through two routes. Either you take PLAB, which is the Professional and Linguistic Assessments Board, or you take MRCP, which is Membership of Royal College of Physicians. Before we go into details of these exams, you should be familiar with the UK training program. This is the old pathway. As you can see, first you graduate from university and you enter into Foundation Year 1. Foundation Year 1 is basically the rotatory internship or the house job as we call it in some countries. In UK, the foundation years are of 2 years. So after FY1, you enter FY2. After finishing foundation years, you have to go into core medical training of 2 years. If you have finished MRCP diploma by this stage, all 3 parts, then you enter speciality training of 4 years. And after completion of speciality training, you receive a specialist certification, and finally you're a consultant. Also note that if you want to specialize in a certain subspecialty of medicine, then at the level of ST5 and ST6, you can take the specialty certificate examinations. In the new training program, there are a few changes. The first change is that after foundation years, you will enter into the internal medicine training instead of core medical training. And this internal medicine training is of 3 years instead of 2 years. By this time, like within these 3 years, you will complete MRCP UK, and then you will enter the specialty training of 4 years. And after finishing these 4 years, you will receive your specialist certificate and you will be a consultant. The post-CCT credentials, or CPD, which stands for Continuing Professional Development, basically means that as a physician, we are supposed to keep ourselves up to date in all areas of our practice. So the Royal College of Physicians, they award some CPD credits and certificates per year to the physicians based on their assessment. Anyway, the main thing you need to know is that at this stage, you're already a consultant. So in summary, the two main changes in the new pathway is that the core training of 2 years has been changed to internal medicine training of 3 years, and the specialty certificate, which initially you were supposed to take at the stage of ST5 and ST6, now you can take at any time. Now you do not have to take MRCP prior to that. There are no eligibility requirements. If you are an MD or MBBS, you can just apply for it. However, the doctors ideally still take it during their specialty training years. The specialty certificate is available in these 12 subspecialties of internal medicine. Okay, so now what is PLAB? PLAB is the licensing exam for international medical graduates. It has 2 parts, PLAB 1, which is a written exam, and PLAB 2, which is clinical skills assessment. Before you can apply for PLAB, it is mandatory for you to take either IELTS or OET. IELTS stands for International English Language Testing System. According to GMC, there is a certain criteria for IELTS, which is that you have to take academic version of the test. The score should be at least 7 in each testing area and an overall score of 7.5. You should get these scores in the same test and in the most recent sitting of the test. For further information on IELTS, you can visit the official website. OET, which is Occupational English Test, is basically designed mainly for healthcare professionals. It is profession specific. So you have to take the medicine version of the test. You should take grade B in each testing area. These grades should be in the same test and in the most recent sitting of the test. For further information, you can visit the official website of OET. Here's a simplified flowchart. So you will take IELTS first, then PLAB 1, PLAB 2. After this, you will be registered with GMC. Then you will enter non-training job, which is Foundation Year 1 and Foundation Year 2. If you have already done Foundation Year 1 in your home country, then you provide an evidence to GMC and you start with Foundation Year 2. After that, you enter core training, which is now replaced by IMT for 3 years. During this time, you take MRCP, finish all 3 parts, And then finally, you are eligible to enter into specialty training. MRCP is a specialty exam. It has 3 parts, MRCP 1 and 2, which are written exams, MCQ based, and then PACES, which is practical assessment of clinical examination skills. After passing all these 3 exams, you're eligible for GMC registration and then enter the specialty training in the UK. However, even if you have taken all 3 parts of MRCP, it might not be possible to start your specialty training right away. You might have to start from the non-training jobs. That is, you entered into the core training first, now called the internal medicine training. You get it signed, and then after meeting some other eligibility requirements of specialty training, you can finally apply for specialty training. The eligibility requirements for specialty training are mentioned on this website. So you take MRCP 1, MRCP 2, PACES, then you take IELTS, and finally you are registered with GMC. But then you might need to start from the non-training job and enter the specialty training later. So which one's better, PLAB or MRCP? If you want to become a consultant, you have to go through specialty training, for which you need to take MRCP. So even after passing PLAB, you will take MRCP at a later point. However, if you take MRCP first, then you do not have to take PLAB exam. But PLAB exams are easy. The MRCP, however, are difficult exams. PLAB has 2 parts, MRCP has 3 parts. PLAB takes less time, maximum 1 to 2 years. MRCP will take more time, minimum 3 to 4 years. PLAB exams, they cost less, MRCP cost more. After PLAB, it is very easy to enter into non-training jobs, and then finally you can upgrade to specialty training when you take MRCP. But after MRCP, it is difficult to enter into specialty training right away, so you might need to start from core training. So in conclusion, ideally after MRCP, you won't have to go through PLAB or IMT. However, it is not easy to get into specialty training, so you might have to start from non-training jobs or IMT before you get into specialty training. Also, MRCP is a difficult exam, so without sufficient clinical experience, it might be difficult for you to clear PACES particularly. Therefore, for fresh graduates, it is better to take PLAB 1 first, as it is an easier exam. So the earlier you enter the system, the easier it will be. The best source for studying IELTS is 12 books from the IELTS Cambridge series. You can also visit the website ieltsbuddy.com, and there are plenty of free videos on YouTube as well. For PLAB, I did not take PLAB by myself, so I'm not really sure. But these 4 resources, which is Samson Mocks, Plabbable Q Banks, Past Medicine Q Banks, and 1700 MCQs by Dr. Khalid, are the most common ones which I've seen students using. Please join PLAB preparation Facebook and WhatsApp groups to find out which ones amongst these 4 are the most reliable ones according to the recent exam pattern. The preparation time for PLAB 1 and PLAB 2 is maximum 3 months each, generally. This is how I prepared for MRCP. For MRCP Part 1, I did theory from Only Notes You Will Ever Need by Dr. Hani Abul Jassim. You can also use Khalid al-Maghribi notes. Many people use them. They're basically the notes that are taken from Past Medicine, but they've organized them very well. Past Medicine question banks are a must. On examination question banks or past test question banks. You can do either one of them. I also did the sample questions given on MRCP UK website. Do join the Facebook and WhatsApp group discussions. I took almost 3 months to study for it. For MRCP Part 2, I did the same, theory from Only Notes. I did past test Q banks, Rapid Ray of Clinical Medicine by Dr. Sanjay Sharma. For ECG, I watched Dr. Najib's lectures on YouTube. For chest x-rays and CT scans, I just Googled them, or I used radiopedia.com. The preparation time was almost 5 months, but remember that it varies person to person. Remember that MRCP is for internal medicine. If you want to do surgery, obs and gynae, or pediatrics, or if you want to be a GP, then they have their own exams. These are the websites I used to gather all this information. So that's it. If you have any questions, you can ask them in the comment section. And don't forget to share this video with your friends so that more people would benefit from it. Take care. God bless you all.